talking to Joanna Swan, who works as a scrub nurse in the operating theatre. Joanna, firstly, remind us what a scrub nurse is exactly and where the name comes from.
Sure. Well, perioperative nurse is the correct term, of course, but basically we're all familiar with the notion of scrubbing in. You know, you've seen surgeons doing it. It's not just washing your hands, it's doing that very thorough cleaning to ensure you're completely sterile before you go anywhere near the patient or the surgical instruments. But the name scrub nurse doesn't quite capture the full role. I mean, basically, your job's to prepare the operating room for surgery. You lay out the instruments, hand them to the surgeon when asked, and you're also responsible for monitoring the patient. So you're like the bridge between the surgical team and everyone else who's supporting the patient.
So how did you first get into this type of nursing?
I remember one of my most formative experiences as a student nurse was shadowing a perioperative nurse in theatre. I had to scrub up too, and I was expected to lend a hand because they didn't want somebody just standing around in the way. It was all new to me, and I was worried how I'd react. I was fine around blood, but I'd never seen a wound being created before. It was a 30-minute hernia op, so nothing special, but it left a deep impression on me. Then later, when I'd reached the stage in my career where I was up for a challenge, that image came back to me.
And what sort of background do you need to go into this kind of nursing?
Well, you can do specialist courses, but I think what's crucial is having a fair amount of nursing experience, particularly in critical care settings. That was true of me, and there's really no substitute for that. To be honest, the job wouldn't suit everybody. The hours can be grueling, and the work's very demanding. You can't just pop out to the bathroom or have a snack when you feel like it. And you're stuck in a small room with some quite strong personalities who are also under pressure. So it's a very intense environment, but also a very rewarding one.
And what skills does it call for?
Well, basically every second counts. You've got to be very efficient and able to think ahead and get things organised. You know, what needs doing immediately, what can wait a few moments, what you need to do now because you might not get the chance later, and so on. I mean, that's the kind of thing you can train somebody for up to a point. But to do it well, you've got to be in the mindset to start with. Attention to detail is crucial. And if that's not how you are, then you're not going to be right for the job. You have to be there mentally 100% as well as physically.
And I guess the idea of the team is really important in theatre.
Indeed. It's got to be part of the system. I mean, especially when you're on call, you never know who you're going to be working with. For an operating theatre to run smoothly, there's got to be clear communication and coordination between everyone concerned, because it's the collaboration within the team that keeps patients alive. In my hospital, to promote team spirit, we set great store by meetings. The preoperative briefing, of course, but also meetings to discuss issues and generate new ideas. As a nurse, it's great to feel that your voice counts, and that's not always the case in medicine. So for me, that's a big plus. We also take opportunities to debrief staff after difficult events. I mean, that's crucial too.
And what about the interactions with the patients?
Well, some people have the idea that in the operating theatre, you're going to be having just mechanistic interventions on patients who are in no position to respond or interact with the nurse, that you're just providing support to the surgeon and the anaesthetist. But these days, theatre nurses are required to have a holistic, patient-centred approach to care, and this extends beyond the period of the patient's actual surgical experience. Preoperative visitings become the norm, so that patients see a familiar face when they come in for treatment, and this can really reduce stress levels on the day for the patient. For me, this is a really positive development, and I'm always keen to take on that role.